Let me ask you a question. Have you ever eaten a fruit thinking it was healthy, only to feel tired, dizzy, or shaky an hour later? You're not imagining it, because not all fruits are good for you, especially after 60. Some can spike your blood sugar, inflame your joints, and quietly damage your heart. I'm Dr. Thomas Carter, and after 30 years of helping older adults manage diabetes, joint pain, and memory issues, I can tell you this: some fruits need a warning label. So, in today's video, we're uncovering 5 popular fruits that may secretly be harming your health after 60, and what to eat instead. Let's get started. 1. Grapes, nature's sugar bomb. They're bite-sized, sweet, and refreshing, but grapes are one of the highest sugar fruits you can eat. Just 1 cup contains over 23 grams of sugar, with almost no fiber to slow it down. That means your blood sugar spikes fast. And for seniors, that's dangerous. I've had patients who ate grapes thinking they were being healthy, but couldn't understand why their blood sugar wouldn't stabilize. The problem? Grapes digest quickly. They flood the bloodstream with glucose, and then the crash comes. Dizziness, irritability, fatigue, and even blurry vision. Now, I'm not saying never eat grapes again, but treat them like candy, a few at a time, never on an empty stomach. Want a better alternative? Try blueberries. They're lower in sugar, higher in antioxidants, and help fight inflammation. 2. Bananas. Not always gentle on blood sugar. I know, bananas are easy, portable, and full of potassium. But here's the truth many people don't hear. As bananas ripen, their sugar content increases. That soft, spotty banana, it's basically sugar in a peel. And for seniors managing blood sugar or weight, that matters. 1 medium banana can have up to 20 grams of sugar, and because there's not much fat or protein, it hits the bloodstream fast. I've seen patients eat bananas daily, thinking it's their healthiest habit. But when we swapped it for a boiled egg or a handful of almonds, their afternoon crashes disappeared. If you love bananas, try eating just half and pair it with protein. Or go for green bananas. They have more resistant starch and less sugar. Ever noticed how bananas make you feel? Leave a comment. Your experience might help someone else. 3. Watermelon. Hydrating, but spikes fast. Hot summer day, you reach for a cold slice of watermelon, it feels perfect. And in moderation, it's fine. But here's the catch. Watermelon has a high glycemic index, meaning it spikes blood sugar quickly. Even though it's mostly water, the natural sugars absorb fast, especially if eaten alone. And for older adults, that can mean energy crashes, blurry vision, and poor circulation to the legs. I once had a patient who said, "Doc, I thought I was dehydrated, but it was a sugar crash from watermelon." The solution? Eat watermelon with some protein or fat, like a few nuts or a slice of cheese. That slows down the sugar absorption. Or choose fruits with more fiber, like apples or pears, to support stable energy. Ever noticed how bananas make you feel? Leave a comment. Your experience might help someone else. 4. Pineapple. A sweet trap for seniors. Pineapple tastes tropical and feels like a healthy treat, but it's one of the highest sugar fruits per bite. Just 1 cup of chopped pineapple has about 16 grams of sugar, and it digests fast. It's also acidic. So if you struggle with acid reflux or take medications that irritate your stomach, pineapple can make things worse. And sugar plus acid, not a great combo for your teeth, especially if you have dry mouth or gum issues, which many seniors do. Here's what I tell my patients. Enjoy pineapple like dessert, a small portion, and ideally after a protein-rich meal, not on an empty stomach. Craving something tangy? Try a few slices of kiwi instead. Lower sugar, higher fiber, easier on your stomach. 5. Dried fruit. The sugar's been concentrated. This one surprises a lot of people. Raisins, dates, dried mango, dried apricots. They look innocent, but they're sugar bombs. When fruit is dried, the water is removed, but the sugar remains. So a handful of raisins? It's like eating a handful of candy. Even just a quarter cup of dried fruit can have over 25 grams of sugar. And the worst part? It doesn't feel like a treat. You eat it fast, you crave more, and before you know it, your blood sugar is out of control. If you're managing diabetes, pre-diabetes, or just trying to keep inflammation low, dried fruit should be a rare indulgence. Better choice? Stick with fresh berries or a sliced apple with almond butter. You get fiber, satisfaction, and stable blood sugar. If you've been snacking on dried fruit thinking it's healthy, don't feel bad. Many people do. But now you know better, and small changes lead to big wins. Final thoughts: fruit should heal, not harm. Fruit isn't bad, but after 60, your body processes sugar differently. Even natural sugars, if eaten in excess or without balance, can cause blood sugar spikes, fatigue, joint pain, and long-term damage to your heart and brain. So, what should you do? Focus on fruits that are lower in sugar, higher in fiber, and eaten with healthy fat or protein to slow absorption. That means berries, apples, pears, avocados. Yes, avocado is a fruit, and it's one of the best for blood sugar control. You don't have to give up fruit. Just choose wisely. Eat mindfully, and always ask, how does this make me feel an hour later? Because that's your real guide. If this helped you rethink your fruit choices, tap the like button. It helps other seniors find this video too. And let us know in the comments, what fruit do you love and how do you eat it to stay balanced? For more real advice from a real doctor, subscribe to Health Hub. We're here to help you age stronger, smarter, and healthier every week. Stay sharp, stay steady, and keep choosing food that serves you, not the other way around.